All right, it looks like we have a healthy attendance here, so I'm going to kick this webinar off. Hello, everybody. Welcome to this RAND webinar on the results of our 2023 Longitudinal Enumeration and Demographic Survey of Homelessness in Los Angeles, LA Leads. My name is Louis Abramson. I'm going to be the moderator for today's discussion. I'm an adjunct physical scientist here at RAND, and in just a second, I'm going to introduce you to my three colleagues who are the authors of this rich and detailed study. But first, I wanted to take a second just to acknowledge who's in this room and contextualize this work in our collective experience. Now, obviously, we at RAND are a bunch of policy researchers, and I know on the call are staffers from elected officials, leaders of homelessness services organizations, community organizers, experts from government agencies, and other professionals who devote a huge amount of time and brain cells to homelessness as a clinical, structural, and governance issue. But we are also all Angelenos. I actually live in one of the neighborhoods that LA Leads covered, Hollywood, and some of you may live in one of the other two, downtown or Venice. But no matter where you live in LA, if you live in LA, two things are clear: the scale of the homelessness crisis and the diversity of people experiencing it. So we don't need to be policy wonks to feel that a core tension in homelessness policy is an inescapable collision between the granular and the systemic. As policy wonks, however, this feeling translates to an understanding that creating effective solutions that work equitably and reliably at a regional scale over decade timescales means building a system that recognizes the 75,000 individual stories of people experiencing homelessness, addresses the 75,000 plus factors that led them to it, and adapts all of its activities on the daily cadence on which their lives change. Now, of course, this is a tough, difficult, and not easy thing to do. And as empiricists, or just folks grounded in the truth, designing this system is only made harder by our need to rely on metrics like the annual point-in-time count, snapshots that flatten stories into summary statistics and turn trends into point estimates. But the data set we're going to discuss today is different. LA Leads lives exactly at the intersection of the granular and the systemic. Its in-depth surveys capture life events for hundreds of people on weekly or monthly bases, tracking recent document and medical needs, outreach and caseworker interactions, shelter offers, and not just the outcomes of those offers, but the reasons why. It does this over a time span now well into its third year, and over geographies comprising some of the highest levels of homelessness in Los Angeles. LA Leads is thus changing our unit of analysis in homelessness from the equivalent of photographs to 30 to 60 frame videos capturing the dynamics of a key population as it is confronted by COVID, inclement weather, policy changes, new interim housing sites, and new permanent housing sites. So I think this is the kind of data we need to make transformative progress in this issue, in this crisis. And I hope all of the decision makers here will come away from this webinar agreeing with me, eager to resource more of this work. Okay, so now I'm going to hand you over to Jason Ward, Sarah Hunter, and Rick Garvey of the RAND Center on Housing and Homelessness to present the results. Two notes before we start: please use the Q&A feature of Zoom to submit any questions. I see people are already doing that. And no, we're recording this webinar, so if you have to scoot halfway through, don't worry, we'll get you a link so you can see the rest as soon as we can. With all that said, I'll pass the baton to Sarah Hunter.
Thanks, Louis. Good afternoon, everyone. Thanks for taking the time today to attend this presentation. We are thrilled to see so much interest in this project that we call LA Leads. As many of you know, we launched LA Leads in fall 2021. We targeted 3 areas in Los Angeles that were known as hotspots for the growing encampments: Venice Beach, Hollywood, and Skid Row in downtown LA. Our study has 2 parts. First, the enumeration effort, which was a count of the number of people living in sheltered in these neighborhoods over time. We explain how we executed that effort in a moment. Second was a survey effort. We wanted to gather input from people living unsheltered, as well. They're the ones directly impacted by many of the policies. At the time, their perspectives were rarely considered during the policymaking process. In other words, we set out to gather information about their housing experiences, preferences, and needs to help inform what resources might work best. Before we dive in, I want to thank our sponsors. This research was funded as part of a gift by the Lowy Family Foundation to initiate the RAND Center on Housing and Homelessness. The survey work in 2023 was also partially funded by the AMARC Foundation. Now I'm going to hand it over to Rick Garvey from RAND's Survey Research Group to tell you more about how we collected the enumeration and survey data.
Thanks so much, Sarah. Hi, everybody. My name's Rick Garvey, and I am a senior survey coordinator with the Survey Research Group here at RAND. I lead the data collection effort, which, as Sarah mentioned, includes running the team, doing enumerations at each of the three areas, so Hollywood, Venice, and Skid Row. And I also lead the survey effort where we sent out a team of interviewers to speak with folks on the street. I have been doing this for about 25 years, and I am boots on the ground. I have been at every single shift, every survey shift, every count for the past 2.5 years. So I've got a pretty good idea of what we're doing out there. Next slide, please. So I'm going to talk a little bit about the enumeration effort first. So as Sarah mentioned, LAHSA does a great job of the point in time count, but that only happens one weekend a year, the last weekend in January. And we were really interested in understanding if there was any variation during the course of the year in terms of the number of folks who were on the street. So what we did was, in order to understand that variation, we decided to do alternating counts where we would go back to the same areas and count them over and over and over again. When we started the project in 2021, we were doing bi-weekly counts on Skid Row and monthly counts in Hollywood and Venice. And we alternate the days of the week that we count. We alternate the time of the month that we count. So sometimes the beginning of the month, sometimes the middle or the end. And we experimented at first with doing morning counts from 5 a.m. to 9 a.m., but decided that with the logistics of traffic and the differences not being statistically significant, to just stick with evening counts. So all of our counts in 2023 occurred in the evening from 9 p.m. to 1 a.m. As I'll show you in a moment, we cover every block and within a defined area of each neighborhood. We don't have the funds or the resources to cover the entire city of LA, nor even the entire area that is Hollywood, Venice, or Skid Row. So we had to make some decisions about where we were going to do the counts. Next slide, please. So one of the things that we do is we count every block and alley, and we count individuals as well as cars and vans being used for habitation. We count RVs, and we count tents and makeshift encampments. In addition, when we're looking at tents and encampments, we differentiate between small, which would be 6 feet or less, medium-sized, which would be 6 to 12 feet, and large encampments, which would be 12 feet or greater. We have a team of a lead and 2 independent counters for every single count. And at the end of each subblock, you can see here on the Hollywood map, we've broken Hollywood up into several sub-regions. When we got to the end of each one of those blocks, we compare our counts and we take the average of the 2 counts. If there's ever a time where the 2 counts are off by more than 10%, we recount that entire region. That actually only happened once early on in the project, and we've gotten pretty good these days at doing these counts. Sometimes they're off by a few. Maybe one interviewer sees a tent as a medium, while another sees it as a large, but for the most part, the counts are fairly stable. So we're going to look a little bit here at Hollywood. When we were developing these maps, we consulted with local homeless service providers. We consulted with the council district offices, and we did multiple investigations where we covered the area, we drove around, we went during different times of the day, we went during different times of the week, and we needed to limit ourselves to what we could cover in a 4-hour shift. So obviously we couldn't do all of Hollywood. So you will see that in Hollywood, the area that we use was Vista to the west, Franklin to the north, Melrose, and then Santa Monica to the south, and Vermont to the east. This did cover most of the hotspots in both Hollywood and West Hollywood. And again, we would alternate the starting point and the direction in which we would do our counts so that we would never hit the same block at the same time at each count. You will also notice, we used Tommy's at Hollywood and Bronson as our staging area, which is kind of right in the middle there. And I've had a lot of Tommy's burgers over the course of this project. You will also notice the weird boundary on the left side of this map. That's the area between Region 1 and Region 2. When we first began this project, that was the council district boundary between Mitch O'Farrell in CD 13 and Nithya Raman in CD 4. We were really interested in how each council person were handling the 4118 sweeps. And we know that one was doing more than the other. So we were interested to see if there was any migration across that line from council districts. Of course, it was then redistricted, so that line actually doesn't mean too much anymore, but we've kept it so that we can, over time, see any changes in these areas. Next slide, please. So looking at Skid Row, again, we worked with service providers such as the People Concerned, Downtown Women's Center, LA Can, and Homeless Healthcare LA. And a shout out to the Homeless Healthcare LA folks. We used the Refresh Center as our staging point for all of the Skid Row activities. And they were kind enough to let us park there for every single one of our shifts. So we didn't have to worry about parking on Skid Row at 1:30 or 2 in the morning. Again, we did multiple investigations at different times of the day and night. And we decided that this would be the area we could cover, which would be from Main Street to the west, Central to the east, 3rd Street to the north, and 7th to the south. We considered actually extending it further south to 8th Street, but it ended up extending the time it took to do the counts so that it really wasn't feasible. So we stuck with 7th Street, and I think we did have a pretty good idea of covering most of that really hotspot area. On Skid Row, we walked every block. So we had 2 different teams of 3 people. We had a lead, which would be me carrying my map and my bag of socks and snacks. And we would cover 2 enumerators and a lead. We split Skid Row in half. So basically to the east of San Pedro and to the west of San Pedro. The area is pretty dense, and it does take longer than you think to count this. So it's usually about 3.5 hours from about 9 p.m. to 12:30. It's about 22,000 steps in case you're interested in how long it takes to do these counts. Next slide is Venice. Again, this is my beloved Venice. I've lived in Venice for over 30 years, and we initially made the decision to only cover the area west of Lincoln. For Venice, we used both cars and street enumeration. So we walked the area to the west and we drove the area to the east. Again, in alternating the areas. So in Venice, we started on the north sometimes and moved south, south sometimes and moved north. Next slide. The other thing that we did, as Sarah mentioned, was administer over 200 face-to-face surveys with individuals we encountered on the streets. We tried to complete them to match the proportion of the counts in each area, and we had 3 teams that included a lead plus 3 interviewers. These surveys were anonymous, and folks were paid $10 for about 20 minutes of their time. In 2023, we did 100 surveys on Skid Row. We did 50 surveys in Venice and 50 surveys in Hollywood. We met and spoke with a lot of colorful and interesting people, and we learned a lot. I'm going to turn it over to Dr. Jason Ward, and he's going to tell you more about what we learned.
All right, thanks, Rick. So I'm going to discuss what we learned from our enumeration, both during the most recent year and across the full roughly 26-month period of data collection. The bottom line from the most recent year of our enumerations is that the number of people living unsheltered did not increase in a statistically meaningful way over 2023 in the neighborhoods we studied. This is confluent with findings from the most recent countywide PIT count. But over the next roughly 10 minutes, I'm going to go into considerably more detail about the data that underlie this finding. I'll quickly introduce to you the methodology we use to generate estimates of the unsheltered population from our count data. I'm going to show you some figures with the path of these estimates over time, and then I'm going to summarize the trends in these data in a few different and hopefully informative ways. So to begin, let's briefly discuss the problem of estimating the size of the unsheltered population from count data. The simplest approach we could take, simply adding up the number of people, the number of tents, and the number of vehicles we see on the streets during our counts, can be broadly informative, but it has 2 problematic assumptions. First, it assumes that there's only one person associated with each informal shelter that we count, tents, vehicles, etc. Second, it assumes that none of the individuals we identify and count on the street are associated with any of these informal shelters, since we're adding everything up. Both of these assumptions are unlikely to be true. So a natural question is, what else can we do? The first approach we can take is to better estimate the number of people living in the informal shelters. So using the survey component of our study, we asked people who we screened for this survey who report living in tents and vehicles, how many people they share this informal shelter with. We then apply these average numbers as multipliers to each informal shelter type. So if you see in this simple example here, if we have 126 tents and we apply the multiplier of 2.3, instead of having a total of 126 tents plus 100 people or 226, instead we have 126 times 2.3 plus 100, we have 390 as our estimate. This is a difference of around 70%, so it's quite meaningful. This mirrors the approach used by LASA, and in our report, we call this the full multiplier approach. This is a better estimate, but it still implicitly assumes that every one of these informal shelters is occupied when they're counted, and that none of the people outside these informal shelter types are associated with them, which would tend to lead us to overestimate. And this is something that isn't discussed a lot in sort of the literature around doing these kinds of counts. So what can we do to sort of address that second issue? Another approach we can take is to make a further adjustment using data from our survey screener. So we also asked individuals if they live literally unsheltered on the street, meaning they didn't use any sort of informal shelter. And we have a measure of that across all the people we screened in these areas. So to better reflect the probability that we're counting some individuals living in these informal shelters who just happen to be out of them at the time we count, we estimate this share living literally unsheltered, and then we multiply the count of people by this factor. So in this example, we estimate the share is 40%. Therefore, we multiply the 100 people by 0.4 to keep only 40 of them in the population estimate. So now now this basically gives us 290 plus 40 or 330. We call this the hybrid multiplier approach in our report. This approach still has a potential problem because it assumes kind of conversely that no one is in their informal shelters when we count instead of that everyone is in them. For this reason, we believe the true population estimate is somewhere between these two estimates, and we simply present them both in the report. So now I'm going to walk through some graphical data on the time series of our counts over the entire survey period, and then focus some specifically on 2023. I'm going to show you the results from both of these methods, and these figures also have indicators for various sorts of encampment clearance events we were aware of over the data collection period that affected the number of people we observed over time. So this figure presents the time series of data on Hollywood using the two adjustment methods I just discussed. The average gap between these estimates is between 200 and 300 people over the time series. You can see a lot of variation from count to count, especially in the first, roughly 15 months of this project, where we were counting monthly. And in a number of cases, we can see that a specific encampment clearing, for instance, this inside safe operation, which was a major event that took place near Cahuenga and the 101 freeway at the end of 2022, was followed by a notable decline in the next count that we conducted, but a relatively rapid return to trend over the following count or two. We can also see evidence of considerable seasonality over 2023. You kind of see this big hump. At the highest point in the early summer of 2023, in this area, at the peak in this box, we estimated the unsheltered population in the Hollywood study area to be between roughly 1,000 and 1,300 people, according to these two methods. This figure presents the time series data from Skid Row. Here you can see the change in the frequency of our counts much more clearly, because for the initial 15 to 18 months in Skid Row, we actually counted twice a month. While we saw some substantial variation from time to time in these early, more high frequency counts, including some modest variation from day to night, you can kind of see this jagged up and down. We ultimately decided that less frequent counts were suitable for learning what we hope to learn over a longer time period. This is particularly true in Skid Row because compared to Hollywood, or what you'll see in Venice in a moment, there have been relatively few kinds of encampment clearances or other sort of large events in Skid Row that are likely to have a major effect on the population from count to count. In fact, we're only aware of one inside safe operation in Skid Row in the spring of 2023. So just to kind of give you a sense of the numbers we're estimating in Skid Row, at the highest point of the year in the summer of 2023, just to the right of this little box with the inside safe operation, our estimates indicated that the unhoused population in Skid Row study area was between about 1,700 and 2,200 people. This figure shows our results for Venice. So similar to Hollywood, across our more than 2 years of data collection, we note a number of high-profile encampment clearance activities that were initially followed by a substantial decline in our counts, but with a nearly uniform return to approximately the prior level within roughly 1 to 3 months. On average, the size of the unsheltered population in Venice in the early part of the study data collection ranged between roughly 850 and 1,000 people, like for instance, around this peak in summer of 2022. By roughly a year later, in the summer of 2023, the range of population estimates declined to between 800 and 900. This is a roughly 50% decline in the gap between the two multiplier approaches that I just discussed. And you can observe this kind of change in the size of this gap most clearly around the end of 2022 here. And you can see that the sort of lower estimate, the hybrid multiplier approach kind of goes up and gets much closer to the full multiplier approach. This was driven primarily by a shift from people living in tents to people living literally unsheltered in Venice. And this shift was reflected in an increase we measured in the share of Venice survey respondents reporting living literally unsheltered across the 2 waves of surveys we did in 22 and 2023, which went from about 20% up to about 46%. I'm going to conclude by further characterizing these data according to trends over different time periods. Doing this will, I think, help marry the patterns in these pictures to our main takeaways about the flattening and the rate of growth of unsheltered populations over the last year. But I think one benefit of this exercise that will also illustrate how the time period one focuses on can have a lot to do with the results of these kinds of trend analyses. I'm going to show you estimates of trends over 3 specific time periods. So first, I'm going to show you a trend for the entire pre-2023 period of our data collection, which went from late 2021 through the end of 2022. And then I'm going to show you a trend just for 2023. We focused in our most recent report on this calendar year because it coincided with the beginning of Mayor Bass's term and also with a large influx of new city council members. And we were interested in how the related policy changes from these personnel changes might translate into changes in the unsheltered population we observe. And then finally, I'm going to show you an annualized rate of change over the entire 26-month period we've collected data for to date. So looking first at Hollywood, consider the trend from late 2021 through the end of 2022, which is this first thick dashed line. We estimated a roughly 5% increase on an annualized basis over this period, but this increase wasn't statistically significant. So it was, just kind of moderate. And if you next consider the trend during just calendar year 2023, it's flat on average, despite that significant seasonal peak that I discussed earlier. So we have 2 periods that had, statistically speaking, sort of 0 levels of growth. But if we look at this third line fitted over the entire period, we see a substantial increase of around 10% on an annual basis that's highly statistically significant. So this just gets into some of the sort of issues around how you measure, right? A big part of the reason that this longer term trend is strongly upward versus the other shorter term trends is that you can see here around the end of 2022, there's this really sharp increase to a sort of a higher average level using the circles and the squares are kind of our 2 estimation methods. So only when we average across this kind of break where we saw a substantial jump in a short period of time can we really get a measure of an overall trend. So this just shows that, a lot of times these measurements are can be artifacts of how long you're measuring them for. For Skid Row, we see over late 2021 and 2022, a steady, significant increase that's statistically significant of around 8% on an annual basis. But if we separately consider only 2023, we actually found pretty reasonable evidence of a moderate decline of more than 6% on an annual basis. This wasn't statistically significant, but that largely has to do with the fact that we counted less, judging from the pattern that we see. But then if you look at the entire period from 2021 through the end of 2023, we see a sort of a rate of change that's almost identical to the earlier period. So, this kind of highlights the fact that it's important to kind of keep measuring and really understand where these things are going over a longer period of time. But this decline in Skid Row, I think, is notable and worth keeping an eye on. Finally, let's look at Venice. From late 2021 through 2022, we see a strong upward trend that amounts to an annualized rate of growth of about 17%. But as we noted in our first annual report from this study, we believed and still do that this substantial increase was at least in part a return to trend from the fact that we began counting shortly after a large-scale effort to house roughly 200 individuals who had been encamped along the oceanfront walk in Venice during much of 2020 and 2021. So if we consider the trend for 2023 only, we see evidence of modest growth in the unsheltered population of around 5%. This is not statistically significant. And then when we zoom out, perhaps counterintuitively, and consider the hold period, we estimate a growth rate that's statistically equal to 0. This, again, is kind of counterintuitive in a way that's like the converse of what I just showed you in Hollywood. But if you notice, a lot of this just has to do with the long time period again. For instance, notice that there were large declines in the populations we counted in early 2023 after the Inside Safe operation at 3rd and Rose, and then another large decline after the Venice Dell encampment clearance in the early summer of the same year. So both of these large short-term declines served to make the average level of unsheltered residents in Venice lower in a way that affected this long-term trend, even though these were followed by pretty rapid returns to previously observed levels in the data here. So just to sum up all this, which I know was a lot in a few minutes, our results are in 2023 are consistent with the findings from the 2024 LASA pit count or the 2023 count, I'm sorry, the 2023 data released in 2024 of roughly 0 net growth in the unsheltered population in LA City and in LA County. In announcing these new results, the city and LASA have suggested at various times a large role for Inside Safe. We found it's natural to think about how credible this claim is. Inside Safe, given the reported totals of people served and the retention rates, appears to have temporarily housed maybe a bit over 3% of the unsheltered population in the city. But we also see in our data persistently rapid rebounds in the unsheltered populations in areas where these Inside Safe operations were conducted. So, I think getting a better sense of how much Inside Safe is responsible for, we need to understand how much of these people sort of are the same people and how many of them are new people, and a lot of details that we don't really have right now. Understanding these things seems very important given the program's costs and the sort of the attention's been paid to it. We hope to develop a better understanding of this in our 2024 survey. Of course, there are also thousands of other housing placements being made each year that likely play a much larger role together than Inside Safe does individually. One factor we believe has not had enough focus is the role of mortality, largely related to drug overdoses. LA coroner data has suggested that over 2,300 people experiencing homelessness died in LA County in 2023. This is equivalent to roughly 4.5% of the unsheltered population of the county, and a number that represents more people than were reported to have participated in Inside Safe. And then finally, because our study really focuses on neighborhoods, it's also worth noting that migration may be playing a role in some of the patterns we see. So anecdotal evidence from our survey team over 2023 suggested to us that unsheltered residents in Venice were increasingly moving east of our study area. For this reason, we began in 2024 counting a large part of East Venice, and we'll be reporting on this in our next annual report. So now I'm going to turn it over to Sarah to talk about the results from our survey effort.
Thanks, Jason. Now I'm going to walk you through some of the highlights from our survey effort. And just a reminder, we recruited all our survey participants from the streets. So all of them were screened as currently living unsheltered, that is not in temporary or interim shelter setting. So as an overview, in 2023, we surveyed 200 people, like as Rick mentioned earlier, 100 in Skid Row, 50 each in Hollywood and Venice between August and October 2023. Most of the respondents told us they had been homeless for more than a year. And when asked where they had been last housed, nearly 60% told us it was in LA County. A little less than 1/3 told us that they were last housed outside of California. And this was more prevalent among respondents from Venice at 41%. Due to the increased attention on the associations between evictions and homelessness, we also asked respondents whether they had lost their housing due to an eviction. About 1 in 5 respondents told us that their housing loss was due to an eviction. On this next slide, I'm going to show you We present the findings regarding how long respondents told us they had been homeless this time. And as the slide shows you, the percentages by neighborhood and by the year of our effort. And so what's interesting to convey here is that, first of all, the percentage of the population reporting 3 years or more is highest in Skid Row. And we're seeing this trend that in Hollywood and Skid Row, the proportion of respondents who are reporting longer durations of homelessness is decreasing. On this next slide, you can see the percentage of respondents by age, military status, and gender. Of note, respondents in Hollywood and Venice tended to be younger than respondents in Skid Row, and we did not find any site level differences in military status or gender across the 3 sites. On this next slide, it shows the breakdown of respondents by race and ethnicity. And as you can see here, the population looks quite different across these 3 neighborhoods, with Black African-American respondents being more prevalent in Skid Row and Hollywood relative to Venice. On this next slide, it shows the site level details on some new questions we asked in 2023 about education and employment. And as shown here, we found that respondents in Venice tended to report higher levels of education and employment relative to respondents from Hollywood and Skid Row, with approximately 1 in 5 Venice respondents reporting being employed. Also, respondents in Hollywood were less likely to report being disabled or being on disability. And this might be related to folks being younger in that area. On this slide, we show findings from the questions we asked about government assistance and past 30-day total income. And that is income received from any source, including government, friends and family, jobs, tips, or other activities, legal or illegal. We did not find any differences on benefit receipt across sites, except that SSI, SSDI, or other disability payments being higher in Skid Row relative to the other neighborhoods. And perhaps relatedly, we found that past 30-day income was also higher among respondents in Skid Row compared to the other neighborhoods. Next, we present the findings from some new questions we asked in 2023. On the left-hand side are the findings about an item about the factors in the past year, if any, had forced the respondent to move from where they had been staying. As you can see here, the most frequently endorsed item was law enforcement, followed by sanitation and other neighborhood residents. You may be wondering about the 14% of other responses, and that was a variety of things, including another person experiencing homelessness. We plan to ask this question again in 2024 to learn more about this and see if there are any changes over time. We did not find any differences in responses across the 3 sites on this item. On the right-hand side, we present the findings from an item where we ask respondents to tell us which of these 4 statements best describe their past 30-day housing search. We show you these findings broken down by neighborhood because we did find differences at the site level. As you can see here, nearly 60% of respondents in Venice are currently not looking for housing, whereas the majority of respondents in Hollywood and Skid Row are looking for housing. Again, we think these differences are important as they may point to the need to tailor outreach strategies to best meet the needs of the population. Next, we present the findings from our new questions about contact with the homeless outreach service system. On the left-hand side, you see the findings from a question we asked about how many outreach workers or case managers the respondents had engaged with in their current homelessness episode. We did not find any differences across the sites in responses, about half reporting 2 or more workers and about 1 in 5 reporting no worker contact whatsoever. Of those that reported being engaged with an outreach or case manager, we asked when was their last contact. As shown on the right-hand side of the slide, 30% told us that they had been in contact within the last 7 days. This was even higher in Hollywood, with 40% telling us that they had contact within 7 days. Just about a quarter told us they had not had any contact in the last 60 days. On this next slide, we show what sort of services people said they had received from their outreach or case manager in the past 30 days, with these 9 options presented as yes or no questions. We did find site level differences here, generally showing that respondents in Hollywood were showing receipt of more services than respondents in Venice, who reported lower levels of service receipt. And this was especially in regard to water and snacks, safe sex resources, documentation and help, housing need assessments, and transportation. On this next slide, we present the findings where we asked respondents for the first time in 2023 about whether they had received any sort of medical support on the streets. For example, a doctor checked their heart or bandaged a wound. And in fact, about half of respondents told us that they had received medical support on the streets. Of those respondents who had received street medicine, we asked, when was the last time they received these services? And 57% told us it was within the past 30 days. This was lower in Venice at 39%, and the percentage of respondents who told us that it was 6 months or longer was higher in Venice at 56%. On this next slide, it gives you a summary of the findings from some of the questions we asked regarding health status. Overall, we find relatively high rates of self-reported chronic health conditions. Also this year, we added a brief screening instrument for identifying a probable substance use disorder. This screener consisted of 5 items that ask about the frequency of alcohol or other drug use, and consequences and experiences related to use, such as giving up activities, experiencing social problems, and physical withdrawal symptoms. 84% of our respondents met the criteria for a probable disorder in their lifetime, and this was not different across the neighborhoods. We also asked for the first time in 2023 about overdose experiences. 29% told us that they had experienced an overdose in their lifetime, and this was lower in Venice at 17%. Next, we asked about whether respondents had a current working cell phone that they could use to connect to the internet and use digital apps. And we found about half of our respondents reported having a cell phone. Of those that had a phone, they seemed to use them for connecting to the internet and digital apps. Regarding documentation, you'll see on the right-hand side of the slide that about half of our sample reported currently having some form of these listed documentation sources in their possession. Next, I'm going to turn to the results regarding questions we asked about housing experiences since becoming homeless in LA. Similar to prior years, we asked respondents whether they were interested in receiving housing and if they were currently on a waiting list for housing. Similar to last year, we found that overwhelming majority of respondents expressed interest in housing, although it was slightly lower in Venice at 85%. When asked if they were currently on a waiting list for housing, 39% reported they were, although this was much higher in Hollywood at 48%. We also asked respondents when was the last time they were offered housing by a service provider. 42% told us they were never offered housing since becoming homeless in LA, and 25% said it was more than 12 months ago. Respondents in Hollywood, again, were more likely to tell us it was within 6 to 12 months, and about 1/4 of the sample told us they had been offered housing within the past 6 months. We asked everyone, since becoming homeless in LA, have they ever been offered the following 10 options? As shown here, group shelter was the most commonly endorsed item, followed by recovery sober housing at 20%, and then long-term stay in a hotel motel setting, for example, Inside Safe, at 13%, which was lower in Venice at 7%. Of note, offers of supportive housing were 11% overall and higher in Hollywood at 19%. We also asked this year, or last year in 2023, if respondents told us if they had been offered any of those particular options, we asked them if they had accepted that option. Here you see the acceptance rates ranged from about 1/4 for shared housing and tiny homes to over around 50% for bridge housing, a long-term stay in a hotel or motel setting, recovery sober living, and safe camping. Keep in mind, all the respondents we surveyed were currently living unsheltered, so that means these acceptances did not lead to a permanent housing solution. We also asked how long people stayed in these settings and whether they left voluntarily or not, and you can find those results detailed in our report. Next, I'm going to turn it back over to Jason to tell you more about how we use these housing offer data.
Thanks again, Sarah. So yeah, we estimated a series of regressions using our survey data to look at associations between respondent characteristics and the reported number of housing offers respondents had received from outreach workers or case managers. In the interest of time, I'm just going to summarize these at a very high level, but we have more detail in the report. We found no full association between age and the number of housing offers received. The associations between various measures of health and the number of housing offers received was weak, or even in the opposite direction, one might imagine. For example, those in the worst self-reported health reported receiving the fewest offers of housing. We found no meaningful association between the number of housing offers received and reporting having an SUD, a serious mental illness, or a physical disability. The only really strong association we found was between reporting being non-white and receiving housing offers. Non-white respondents reported receiving housing offers at roughly double the rate of white respondents. Overall, our takeaway, with the caveat that this is a relatively small sample and there's important selection, as Sarah alluded to, is that these findings are not super consistent with what you would expect of an acuity-based system. However, that kind of selection bias, the fact that we are surveying people who are unsheltered, may be an issue. I mean, you can imagine a world in which all the most high acuity people are off the streets now, and we're just getting, these kind of weird patterns because of that. However, the fact that we still see more than half our sample reporting being continuously on the streets for 3 or more years and around 75% for 1 or more years suggests that this is not necessarily a super compelling thing to think, and that there may be some work to do really to make the system more responsive to various measures of acuity. And then I'm just going to close by kind of reiterating the key takeaways from this year's annual report. So as I mentioned earlier, we found that over 2023, the number of unsheltered residents did not grow in a meaningful way in any of these neighborhoods. We also found continuing evidence that local encampment clearance activities don't appear to lead to a persistent reduction in the number of unsheltered residents in the area. They tend to just move them around, and the numbers tend to return in our relatively small study areas to previous trends pretty quickly. We found extensive evidence of caseworker engagement with unsheltered residents, including a high incidence of street medicine encounters, which was perhaps one of the most impressive findings from just based on our priors, at least. This engagement in general was highest in Hollywood, which seemed to be uniformly sort of getting to people more regularly and more quickly with these kinds of services. And then finally, broadly, I think our survey results suggest substantial differences in characteristics of these local unsheltered populations on multiple dimensions, including age, income, and even things like the reported desire for housing. So this variation suggests to us, kind of as Louis alluded to at the beginning, a need for engagement in services that are strongly tailored to local needs. And then I'm just going to talk briefly about future directions for this study. Our data collection as of now, is ongoing. So we've actually still been doing bi-monthly counts up until the present, and we're preparing to deploy another round of survey data collection with a larger sample size in this past year. And in particular, something that, Sarah alluded to, the questions we're asking about being offered housing and whether you accepted it, et cetera. We found those, we got some interesting information out of doing that, but we found that you really need a pretty large sample to do this because these things are still relatively rare events. So we're going for a considerably larger sample this year to try to make some progress on those kinds of topics. We also recently concluded data collection on a large-scale survey-based study of transition-age youth experiencing homelessness and housing instability that was sponsored by the Hilton Foundation with the goal of trying to understand the role that foster care experience may play in these outcomes. This involves surveying over 400 of these TAE from all over LA County. And then we also followed and interviewed a subset of about 25 of these youth monthly over the course of a full year to learn about their experiences navigating housing and other challenges, and how they're, and sort of the broad takeaway, I think, is that these youth were experiencing a lot of rapid changes that are interesting to learn about. We expect the first report from this project to be released by late August. And that's it. Thanks again to everyone for their attendance and interest, and I'm going to turn it back over to Louis now for questions.
Thanks very much, Jason, Sarah, and Rick. We have some questions coming through here, but I'm going to take the moderator's prerogative and ask the first one and I'm going to direct direct these at you individually. So I think the first one, I'm gonna ask Jason, and there's lots of discussion. Always, the 2024 count just was released between the split in the population. We talk about sheltered unhoused folks and unsheltered unhoused folks, and I'm just hoping you can opine based on the LEADS results, your thoughts about how the public should interpret changes in one versus the other, because as you mentioned, factors beyond housing placement affect the unsheltered population, including, unfortunately, mortality. And so when we're thinking about the performance of the homelessness system writ large, should we focus more on declines in unsheltered homelessness or increases in sheltered folks, or if there's both, what does LEADS suggest about the link between these two populations?
Okay, so super simple question. No, that's a very huge question. In terms of our study, obviously we focus on this specific population of unsheltered individuals, so that's kind of a limiting factor. And even when we look at like how these people interact with housing, we're seeing them in the state of being unsheltered. So, as I sort of alluded to earlier, there's this limitation of what we can really learn. But, I think if you see the unsheltered population declining, you should see the sheltered population increasing, just because of the kinds of constraints we're operating under in LA, right? Where it's a very housing scarce environment. So like, it's sort of, I think, a first step for some measurable progress to see a shift away from unsheltered homelessness towards sheltered homelessness, which in a place like New York is really the vastly predominant mode of homelessness, because they have sort of a right to shelter mandate that's very, very expensive and costly to implement, but they have relatively low rates of unsheltered homelessness, even in the face of very high rates of homelessness overall. I think we understand a lot less about the effectiveness of the sheltered homelessness part of the system. And that's something that I think future research could really do well to focus on. We would love, for instance, to be involved in a rigorous evaluation of a program like Inside Safe or other sort of large-scale interim housing and shelter programs. I think this evidence could really help improve system performance. But, to date, even getting very basic information from the mayor's office on simple outcomes from Inside Safe, even under the orders from a judge, has been incredibly slow and difficult. So, that I'm not sure how feasible that is, but it's a worthy goal. To your sort of last point, I think in terms of how the system is performing, it's obviously important to think about these changes between sheltered and unsheltered homelessness, but and also, importantly, measures of long-term resolution of homelessness. I think the data from LAHSA in the last couple of years have improved notably in terms of just putting out useful data points to the extent they have the information, but LAHSA also doesn't have all this information, partially because of the labyrinth of jurisdictions around LA. But beyond measurement issues, to your sort of biggest question of system performance, I think the system's ultimately constrained by both the housing stock and the capacity to provide services. We've heard a lot about this in some recent work we've done with service providers and housing developers. I think we're already experiencing substantial constraints on the services side at the current level of subsidized housing production. And that's an immediate problem, especially in terms of resolving homelessness successfully for the highest acuity people. But then finally, I think that the most important but least focused on part of what I would think of as the system writ large is housing production in LA. And there we're still doing very poorly, despite there's been some temporary bright spots like the original version of ED1, that's sort of rapidly seeing a lot of retrenchment. Overall, I think LA still treats the production of even 100% affordable housing like a problem more than like a solution. We're protecting historic neighborhoods from 100% affordable housing and things like this with changes to city policies. So I think until this status quo changes in a dramatic enough way to broadly affect the rates of housing cost burden and overcrowding, both city and county-wide, the system's always going to likely underperform, and probably the best outcome we could expect to see in the medium term is a substantial growth of sheltered homelessness and perhaps modest reductions in unsheltered homelessness.
Yeah. Okay. Thank you, Jason. Quick, Sarah, maybe a slightly less highfalutin question. What's one thing you wish you had asked folks in the questionnaire that you weren't able to include this round?
Thanks, Lily. I think, given our work on transition age youth and their trajectories into homelessness, I think we wish we had asked about child welfare involvement But we have added that question to our 2024 effort. But I think, kind of answering that question in a different way, what I really wish we could do is survey more people so we could take a deeper dive into the characteristics associated with different housing and shelter acceptance rates. But we'll have a larger sample after our 2024 survey effort to start looking at those subgroup comparisons. And I'd also like just to enumerate and survey a larger geography. Perhaps, capturing all of Venice, perhaps south of Venice, because we think people have been displaced over time due to the increased activities, the sweeps. We'd also love to include all of Hollywood. So if we had more resources, we could easily scale up and do this.
And Rick, last one from me to you. And I think this may tie into some of the questions that are coming in from our audience. In your opinion, what's one sort of folk narrative, for lack of a better word, one idea that may be prevalent amongst folks who aren't policy wonks in homelessness that Leeds seems to support, and maybe one it pushes back on?
Sure. I think one that I hear a lot is that most homeless folks are not from California and that they're just here available. And I think what we have seen in our surveys is that most people actually did complete housing. They have been housed here in California and specifically here in Los Angeles. The other thing that I would note is that, we've talked about it before, but the sweeps and, either sanitation, care plus sweeps, or enforcement of 4118 areas, they actually don't help. They do remove the number of tents, which can be good if you're just driving down the street and you don't want to see tents in front of your block. But in terms of actually housing people and in the overall numbers, we do not see any difference in the areas. And so it's basically just whack-a-mole.
Okay, so lots of insights here, and the report is online for folks to dig into deeper. I'll maybe now turn to some of the comments from the questions from the audience here. Some have been addressed. There's one question about the providers in one of the Leeds locations, Hollywood. Since that's my beat, I'll quickly answer. Yes, Hollywood is it does have many providers, which may help explain some of the trends we're seeing. For the transition age youth population, we have My Friend's Place and the LA LGBT Center. We also have Covenant House. Those are all in or near the footprint that was studied. And for adults, we have the Center in Hollywood. PATH has outreach teams in our area, as does the People Concern. There's a major Department of Mental Health initiative in Hollywood now called Hollywood 2.0. As part of that, about 150 beds were added right around summer 2023, when Leeds reveals a pretty strong drop in the unsheltered numbers. So it's potential that there's a connection there, as Jason was discussing. And also in Hollywood, there is a very robust community response through volunteer organizations such as the Sealand Neighborhood Homeless Coalition, the Hollywood Food Coalition, to name a few. And these are all convened by a major convening entity called Hollywood Forward. So I think my interpretation of the Hollywood high side outlier results hopefully speak to the efficacy of this wealth of services, both at the professional and the non-professional levels. And when you have conveners that allow these to work in coordination, good things happen. Let's see. There was a question also, I'll throw this maybe over to Rick, about any data. We mentioned mortality statistics from overdoses on the call, but obviously many more things might unfortunately lead to deleterious health outcomes in the unsheltered population. Rick, are there any other resources folks could go to get statistics on things that aren't related to overdose deaths, but are contribute to mortality in unsheltered homelessness?
Yeah, there sure are. Actually, the LA coroner released a really good report this past January that covers the period between 2022. It shows a complete breakdown of all the different ways that people are suffering from mortality. It's not just overdose. Actually, the second most popular reason is for transportation issues, being hit by cars, hit by buses while on the street. But I definitely would send people over to the coroner's report. It's a very good report.
Okay, one more here. There's a question about asking if other essential needs, for example, medicines, I guess the retention of essential documents and possessions, and how they might be affected by the movement of people due to the various factors that were listed in the survey. What can Leeds say about folks' ability to retain critical documents, critical belongings that will ultimately help them on their journey to housing as they're unsheltered? This is in the report. I'm opening to whoever wants to address it.
Sure, I'll take that, Louis. I mean, we didn't really have enough of a sample, enough people to look at, you know, the relationship between types of documents, reported displacement, time on the streets. But that's something perhaps in the future, once we have a larger sample, we could start looking at if there are characteristics among people who report having or not having documentation, and how that's related to them being displaced on the streets. That's a really good question.
And maybe one more. There is you have an extensive table in the report about the rates at which folks are offered housing, and you break it down by various typologies, which contributes to a discussion we're all having around what is the best kind of interim housing or shelter to build going forward to achieve maximum impact. Does anybody want to comment on your findings about offers of the rate at which folks are offered shelter and the rates at which they accept them as a function of the shelter typology?
Again, similar to what we found in our report last year, was that, you know, group shelter is only accepted among, you know, or a preferred option for a small portion of the population. But we did find across the board among the people that we surveyed, obviously they were still unsheltered, that while, you know, maybe half of them had accepted some form of shelter along the way, they currently are still unsheltered. So it hasn't been a good fit for one reason or another. Again, once we have a larger sample next year, we can start to look at characteristics among the people who accepted and did not accept different shelter types, to see if we can come up with recommendations from what our data are telling us.
I'd also add that there are different availability in each region, right? So, you know, Venice has had a bridge house actually about to close, and Hollywood has 2, and Skid Row has a couple, and Skid Row has shelters that Venice and Hollywood don't have. So I think it's important to look at the different areas when you're trying to think about whether people are accepting the offers.
All right, folks. So we're running into time here. I know all of us could talk about this subject for hours and hours and hours. So again, I'll just say thank you once again to Jason Ward, Sarah Hunter, and Rick Garvey here for leading this incredible and detailed and sophisticated work. We're very much hopeful it continues on many years into the future to keep generating insights that we can use to help us all address this crisis from all different directions. So I'll just say, I think this work showcases exactly what we can do at RAND, exactly why we're here as a group of folks who think hard about the most challenging issues facing our society, and we're very eager to continue being resourced to do this going forward. So thank you again to our panel. Thank you again to all of our wonderful audience members for attending. This again, the video will be released to you as soon as it's ready via link, as will the slides, which we hope to get to you by the end of August. So again, I'm Louis Abramson. Thanks so much for joining us, and we'll see you soon.